issued at the end of the virtual extraordinary National Executive Council meeting 2020. The National Executive Council of the Nigerian Association of Resident Doctors held an extraordinary National Executive Council meeting virtually on the 20th of June 2020. The meeting was attended by over 300 members of the association across the country. The NEC deliberated extensively on the ongoing NARD strike that commenced on the 15th of June 2020, following an extraordinary National Executive Council to consider the federal and state government's responses to our minimum requirements and demands. Observations were that the NEC, National Executive Council, acknowledges the provision of personal protective equipment to some hospitals. However, because these personal protective equipment are consumables and they are not reusable, there's a need for sustained supply in our various hospitals. That the medical residency training funding has been included in the revised 2020 budget through the intervention of the Honorable Speaker, House of Representatives, and will be implemented as soon as the budget is assented to by the President. At the same time, we await the fulfillment of the promise made by the Nigerian Governors Forum to ensure same is done in all the states. On the salary shortfalls of 2014 to 2016, the Secretary to the Government of the Federation has promised to intervene. Government has shown commitment to procure group life insurance for healthcare workers. The disengaged resident doctors of the Jos University Teaching Hospital have been reinstated. The Chief Medical Director has been directed to pay their withheld salaries and comply with the provisions of the Medical Residency Training Act. On the state tertiary health institutions, the chairman of the Nigerian Governors Forum, His Excellency, the Governor of Ekiti State, Dr. John Kayode Fayemi, as well as the Director General of the Nigerian Governors Forum, Mr. Ashishana Okauru, has appealed to the Nigerian Association of Resident Doctors to be given time to discuss with other state governors of Kogi, Gombe, Lagos, Oyo, Osun, Ogun, Ondo, Kaduna, Nasarawa, Enugu, Anambra, Abia, and Imo states to implement pay parity as well as corrected comments of 2019, as well as the salary shortfalls due to our members be paid. NARD also favorably look into our challenges of members in Lautech Teaching Hospital, Ogbomosho, with a view of abiding by the international standard. That the Executive Governor of Delta and Benue States have been supportive based on the information available to us from our members. The National Executive Council also observed that the COVID-19 inducement allowance has only been paid to 11 federal health institutions, and most state governments are yet to review the hazard allowance of healthcare workers in their states. The National Executive Council of the Nigerian Association of Resident Doctors resolved to suspend the ongoing indefinite strike action with effect from Monday, the 22nd of June 2020 by 8 a.m. prompt. The national officers shall continue negotiations with stakeholders, and progress made shall be reviewed in 4 weeks during the next National Executive Council meeting in July 2020. To suspend the strike action was taken in order to give the federal as well as the state government time to fulfill the outstanding demands following an appeal by the Speaker of the Federal House of Representatives, the Secretary to the Government of the Federation, the Chairman, Nigerian Governors Forum, and other stakeholders. The Nigerian Association of Resident Doctors, on behalf of the entire membership of the association, express their heartfelt gratitude to the following distinguished individuals. His Excellency, the Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, President Muhammadu Buhari, GCFR, the Honorable Speaker, Federal House of Representatives, Right Honorable Femi Gbajabiamila, the Secretary to the Government of the Federation, Mr. Boss Mustapha, the Chairman of Nigerian Governors Forum, and the Executive Governor of Ekiti State, His Excellency, Dr. John Kayode Fayemi, the Executive Governor of Oyo State, His Excellency, Engineer Sheyi Makinde, the Honorable Minister of Health, Dr. Osage Ehanire, to give room for further negotiation. And the Nigerian Association of Resident Doctors believe that 4 weeks is a good time for any meaningful negotiation to yield results. And as such, the position of the Nigerian Association of Resident Doctors, which is currently to suspend the strike, shall be reviewed in 4 weeks' time, following which further actions shall be taken on what to do next. Thank you. And we have also been assured that immediately that implementation shall commence immediately. We want to believe that we wouldn't need to wait for another 4 weeks before the budget will be assented to. Secondly, the ongoing payment of the COVID hazard allowance has only been effected in 12 hospitals in Nigeria. I also want to believe that we do not need 4 weeks to complete the payment that has commenced so far, and that we believe should be concluded in good time before the end of the 4 weeks, during which our next meeting will hold. We've also been assured by the Nigerian Governors Forum to look into the plight of our members in the state tertiary health institutions across Nigeria, with the view of implementing the Medical Residency Training Act in these states. Again, we do not believe that 4 weeks is a short duration to get that done and taken care of. So basically, our demands are demands that we are optimistic that if the government is sincere and committed to resolving our demands, that can be resolved within these 4 weeks that has been given to the government.